Administrative Order Number 184, Section 1972. As stated in the said administrative order, the revised rules and regulations included herein governs the collection, processing and sale of the human blood, and the establishment and operation of blood banks and processing laboratories. This order was formulated to answer the letter of instruction number 42 dated November 28, 1972 and served as the supplementing rules and regulation of the blood banks and processing laboratories. Included in this order are number 1. Provisions pertaining to the operation of blood bank with a license and the prohibition of any person to contact and transfuse blood unless they are registered physician and follows the standard requirement. Number 2. No person, agency, and establishment shall engage in the peddling of human blood and recruiting donors for materials consideration. Number 3. Human blood should not be the subject for public bidding but should be procured only through licensed blood banks at a cost. Administrative Order Number 242, Section 1975. It amends Section 5 of the previous administrative order regarding the cost of human blood. The cost of human blood types A, B, and O is a set of 55 pesos and additional 5 pesos for the use of plastic bag and charge of 25 pesos for additional test performed. The qualified donor is also given 50 pesos as an honorarium covering their meal, transportation, and other expenses. Administrative Order Number 291, Section 1976. It amends Section 7 and Section 13, subsection of Administrative Order Number 156, Section 1971. In Section 7, additional provision is that a physician may be allowed to operate and manage a blood bank provided he or she is registered with the Board of Medical Examiner to practice the medical profession in the Philippines, has undergone training in a blood bank from an accredited blood bank institution, and is certified in competency by the medical board. On the other hand, Section 13, subsection states that the requirements of a blood bank and blood processing laboratory, including supervision and management, must be carried out by a registered and qualified physician who is allowed to manage not more than 2 blood banks. In addition, all medical technologists and medical technicians must be registered. Also included is provision on the hiring of registered medical technologists for 20 blood donors and additional registered medical technologists for the next 20 blood extractions per day. Administrative Order Number 293, Section 1976. It contains only supplementary provision on the collection, processing, and sale of human blood and the establishment of a blood bank and a blood processing laboratory. Number 8. Penalties from Revised Penal Code of the Philippines. In the process of operating a blood bank outlet, the operator should be familiar with the penalties imposed by the Revised Penal Code in case of illegal transactions. Next is legal issues and concerns. The legal issues and concerns are based on certain observations on several blood bank outlets independent or within the hospitals. Apparently, some blood banks impose the policy of having a blood donor if the patient is in need of blood bank for transfusion. The only reason is to have a continuous supply of blood bags for other patients. Another issue concerns whether nurses should carry out the phlebotomy procedure. They have been authorized to perform the said procedure due to the increasing number of registered nurses as opposed to the decreasing number of medical technologists. Next is the National Blood Service Act. Provisions of Republic Act No. 7719. Republic Act No. 7719 is otherwise known as an Act promoting voluntary blood donation, providing for an adequate supply of safe blood, regulating blood banks, and providing penalties for violation thereof. The three main parts of RA 7719 are the preliminary, functional, and concluding provisions. Preliminary provisions. These preliminary provisions cover all aspects regarding the formulation of the titled Declaration of Policy and definition of terms. This Act shall be known as the National Blood Services Act of 1994, titled in Section 1 RA 7719. In order to promote public health, it is hereby declared the policy of the state to promote and encourage voluntary blood donation by the citizenry and to instill public consciousness of the principle that blood donation is a humanitarian act, to lay down the legal principle that the provision of blood for transfusion is a professional medical service and not a sale of a community, to provide for adequate, safe, affordable, and equitable distribution of supply of blood and blood products, to inform the public of the need for voluntary blood donation to curb the hazards caused by the commercial sale of blood, to teach the benefits and rationale of voluntary blood donation in the existing health subjects of the formal education system in all public and private schools, in the elementary, high school, and college levels, as well as the non-formal education systems, to mobilize all sectors of the community to participate in mechanisms for voluntary and non-profit collection of blood, to mandate the Department of Health to establish and organize a national blood transfusion service network in order to rationalize and improve the provision of adequate and safe supply blood, to provide for adequate assistance to institutions promoting voluntary blood donation and providing non-profit blood services either through a system of reimbursement for costs from patients who can afford to pay or donation from governmental and non-governmental entities. Functional provisions. The functional provisions are limited to orders on the voluntary phase-out of commercial blood banks, rules and regulations on blood bank service, importations of blood bank equipment, and penalties associated with blood bank provisions violations. Concluding provisions. These provisions focus on the separability and repealing clauses. If any provisions of this Act are declared invalid, the other provisions hereof not affected thereby shall remain in force and effect separability clause in Section 13 RA 7719. This Act shall supersede Republic Act No. 1517 entitled Blood Bank Act. The provisions of any law, executive order, presidential decree, or other issuances inconsistent with this Act are hereby repealed or modified accordingly. Repealing clause in Section 14 RA 7719. Administrative Order No. 09, Section 1995, otherwise known as the Rules and Regulations Implementing RA 7719. Also known as National Blood Services Act of 1994, took effect on May 12, 1995. It consists of 9 chapters. Chapter 1 covers the designated name of the order, scope, and definition of terms. Chapter 2, titled National Voluntary Blood Services Program, deals with the composition and functions of the Blood Program Committee, including the field representatives of the National Committee and the DOH Program Management. Chapter 3 covers voluntary blood donation and the composition, function, training, and technical assistance of the program. It also includes the program's promotion in schools, communities, and professional education, in which the Professional Regulation Commission, or PRC, professional organizations, and associations are required to participate and play their roles. Administrative Order Number 17, Section 1998 is an amendment of Administrative Order Number 9, Section 1995. Such amendment pertains only the issuance of cellular phones and pagers to qualified personnel such as the DOH, Central Office, and coordinators of the program. All monthly rental fees arising from the use of cellular phones and pagers are chargeable to the program. Administrative Order Number 2005-002 contains rules and regulations amending pertinent provision of Administrative Order Number 9, Section 1995. It consists 24 sections, including provisions on the rationale of the establishment of the Philippines National Blood Services on January of 2005, scope and coverage of blood bank services and definition of terms, promulgating rules and regulations concerning the structural organization and management of Philippines National Blood Services and general guidelines that should be observed by the personnel of the department, and operational and management of the Philippine National Blood Services, including its staffing and equipment. The remaining sections cover the separability and effectivity clauses. Administrative Order Number 2008 ensures accredited blood service facilities with adequate staff and personnel, equipment, and other resources in order to perform all the functions effectively, safely, and efficiently for the protection and promotion or health of the people.